Hi there, it's Uzo Ehiog here from Integrated Clinical Strength and Conditioning. So, welcome to today's video tutorial. It's all about skills and capacities. Now, I hear you say, what on earth are skills and capacities? Well, okay, skills and capacities essentially. Now remember, we always bring you the good stuff, okay, from the strength and conditioning field. And this is one of these things that is one of the good things, okay, that we can take away from our strength and conditioning colleagues. Okay, skills and capacities. In essence, it's a methodology and a framework that allows you to make sense of your exercise selection. So it's a clinical reasoning tool, okay, that you can use, okay, to improve the fortunes of your patients and to make your exercise prescription a little bit more specific and a little bit more enjoyable for you. So, what's it all about? Exercise prescription. As rehabilitation professionals, okay, what we're really after is some type of training transfer. What do I mean by that? Well, training transfer, essentially, it's the holy grail of rehabilitation and also strength and conditioning. Okay, because what it relates to is this principle of specificity, doesn't it? Okay, we all talk about being functional. Oh, you got to get functional. You got to go functional. Get functional as fast as you can. Yes, that is true. But actually, okay, the end state of functionality, okay, is the target task itself. Now, we've covered things in the past like the SAID principle, and you'll sort of remember that from 101, okay, exercise prescription, okay, in your first year of your undergrad degree. Okay, the SAID principle, essentially, what it attests to is specific adaptations to impose demands. So for you and me, what that means is you get what you train, quite simply. So, why is this important? Well, training transfer, as I said, it's the holy grail, essentially, of rehabilitation and also S&C for that matter. But we're here to talk about rehabilitation, so let's stay with that. Okay, training transfer, okay? You give a patient, okay, a prescription of exercise, whatever that may be. Okay, what you're hoping for, okay, is that is going to improve the fortunes of that patient, okay, some way down the line. Now, it might be that it improves the fortunes of that patient very quickly, but it also might be that it takes several months to improve the fortunes of that patient. And what I mean by fortunes is their end outcome goal. What is it they actually want to achieve? What's their end target goal? So, what are the different types of training transfer? Because that's an important thing for us to define. So, you've got three different types of training transfer. The first one is primary transfer. Now, when we're talking about primary transfer in terms of training that we do with our patient, or the exercise prescription that we do with our patient, and it's primary transfer, well, basically, like, you have to practice the activity. So, for example, if your goal is, okay, to help your patient to lift her trolley, okay, to put it on and to climb up onto a bus, and there's a little step to get onto that bus, because, you know, most buses now sort of are not low to the ground, are they? There's a little step normally, okay? Then the primary transfer is that task. You would have to go out with your patient, with their trolley, and find a bus, and essentially coach that patient climbing onto the bus. Not really that practical, is it? Yeah, so primary training transfer. So you have to practice the activity, the occupation, the sports skill, okay? Then we've got this idea called secondary training transfer. And this is where most of what we do falls into. And it's where we are developing either the skills or the capacities or the physical qualities that relate to specific impairments that then relate to the primary outcome task. Yeah, so the patient we were just talking about a moment, what capabilities can we do to improve that patient's essentially physical qualities or skills to allow them to do that? And then we've got something else called tertiary transfer, and this is where we sort of develop general capabilities that might provide some overall general benefit. And to give you a concrete example, it would be injury prevention related work. Okay, for example, to improve, hamstring strength or trunk or trunk strength or trunk muscle performance for an athlete, say for example. So we don't really get into that in the realms of rehabilitation. Okay, so it's really helpful if we think in terms of skills and capacities. And the reason why that is because it then allows us, okay, really essentially to break up, okay, that secondary training transfer and to decide on, well, what is it the patient actually needs, and what do we need to actually do to improve their fortunes. So I guess the simple question that you need to ask yourself is this problem that I'm dealing with, after obviously your physical assessment and such like, and you've taken a history, is this problem that I'm dealing with a skill related problem? So let's define what a skill is. Essentially, a skill is a skillful movement, okay, in which a predetermined objective, so an end outcome goal, is accomplished or achieved with, key points here, the maximum efficiency and the minimal outlay of time. So basically, does it look good? That's kind of what it is. You know, we can all look at someone that's really skillful, and it's easy to see because it looks really easy, doesn't it? It's like they do it with such finesse. And that's the question you're asking yourself, okay? And really, you can go a step further into that, because really what we really want to know is, can that patient transfer force, generate force, and absorb force during that particular activity? Is the shape that the patient's making, does it look good? Yeah? Does it look okay? Does the shape look okay? Because if the shape doesn't look good, okay, i.e. that the posture that they're making, we can often just look at people and we can say, this doesn't look, they're not doing a very good job of that, okay? So that's the key thing there. Is it a skill-related problem? The next issue is it a capacity-related problem? So capacity really, okay, grandiose term for physical qualities. That's essentially all it is, okay? It's just another word for saying physical qualities. And the capacities that we're talking about are things like muscle strength, rate of force development, mobility, aerobic fitness, anaerobic capacity, local muscular endurance, and balance. Yeah? These are the physical qualities that we're kind of quite familiar with in the physiotherapy realm. All we're doing, in essence, essentially, is we're putting it into some sort of context. So let's give you a very concrete clinical example. So, let's say, for example, we have a patient who has difficulties with sit to stand. Okay? Now, this is not an uncommon presentation to see in most physiotherapy clinics. Okay? Especially with the frail and elderly as an example. Now, often, and this is my bias to a certain extent, this is what I think, often what we'll do is we'll just simply practice the skill with that patient. Yeah? So we'll get the patient to do multiple sit to stands. Now, in essence, there's nothing wrong with that, really, okay? Because if the patient does multiple sit to stands, okay, they're going to improve, okay, some of their physical qualities, and they're also going to improve some of their skill development potentially. But what I want you to do is I want you to take a step further. I want you to take this a step further, and I want you to actually hang your hat on what you think, okay, may be wrong. So let's use this as a practical example. So sit to stand. So if they practice the skill, okay, of sit to stand, then essentially what they're doing is they're improving, okay, they're improving their skill base, okay, and what they're essentially doing is they're getting better at using their physical capacities. So they're getting better at using their physical qualities, because you need these physical qualities in order to execute the skill of sit to stand. Yeah? And skill related factors, if we look at it mechanistically, okay, and I think we should sometimes, because that then helps us to unmuddy the waters, is essentially what we're doing is we're improving motor learning and intermuscular coordination. Yeah, so the coordination between multiple different muscles, multiple different joint segments all together. Now compare that, take this another step further. So same patient, okay, it's not a skill related problem now, they have a capacity related problem. And it might be that actually their sit to stand is challenged because what they need more of is an increase in isolated muscular strength. So if you improve their physical capacity, that then allows them to access the skill. So hopefully what you can see is that actually, okay, yes, you could just practice the sit to stand, of course, yeah, okay, and I guess you could overload the pattern, okay, to a certain extent, but getting people to do endless sit to stands, okay, one, it's potentially not the best use of the patient's time and their time, i.e. they could be doing that for a very, very long time, okay, but equally so as well, you may not necessarily be getting to the nub, okay, of what it is the patient needs. So when we look at the actual mechanisms that are improving their capacity, so for example, okay, it's going to be things like intermuscular coordination. It's going to be things like changing the morphology of that muscle. So an increase in muscle cross-sectional area, an increase in size, an increase in the material properties of that tissue, and also some neural changes as well. So I hope what you can see from this very short video is that actually it is important to try and define, okay, whether you think your patient is dealing with a skill problem, or whether you think are dealing with a skill problem, or whether you think you are dealing with a capacity problem. Okay, try not to sit on the fence, because it's easy to sit on the fence. Okay, yeah, plant your pole in the ground and say, I think this is a skill problem, or I think this is a capacity problem. Okay, and then it will make your reasoning so much easier. Okay, and also it will make the process so much more enjoyable for you, and the process becomes so much more effective for the patient, because it's easier for you to explain what actually is going on, as opposed to somewhat muddled thinking where we try to cover as many different aspects as possible, because essentially we throw as much mud at the patient and we hope that something sticks and the patient gets better. No, don't do that. Okay, be very clear on what it is you are trying to achieve. Is it a skill problem, or is it a capacity problem? Every now and again, it may be it may be a bit of both, but there'll be one which has an overriding factor, okay, and that you need to work on at this particular moment in time. You heard it here first: skills and capacities. Okay, thanks for listening. Join our community. Speak to you soon. Bye for now.